Hi, I'm Dana Hurst, Director of Health and Wellness at People Corporation. And today we're here to talk about mental health. And specifically, we're going to touch on awareness, stigma, stress, helping yourself, helping others, and happiness. So, what is mental health? Well, according to Health Canada, mental health is the capacity to feel, think, and act in ways that enhance one's ability to enjoy life and deal with challenges. It's really about coping and thriving and being able to go about your regular routine without disruption or difficulty. Similar to health being a state of complete physical, mental, and social well being, and not merely the absence of disease, mental health is more than just the absence of mental illness. So, what does good mental health mean? Well, it means that every individual realizes his or her own potential, that each and every one of us feel well, we can cope with the normal stresses of life, that we can bounce back from challenging circumstances and work productively to achieve our personal and professional goals that we set. It's also about being able to maintain positive relationships and being able to contribute to your community. So, what are mental health problems? Well, they're temporary problems that can interfere with our ability to function and affect our quality of life. Mental health problems differ from mental health disorders because they're not medical diagnosis and only temporarily limit our ability to function. They're short-term reactions to difficult circumstances. We all experience feelings of loneliness, emotional distress, or fatigue, sadness, or grief. These feelings are normally short-term reactions, though, and they're usually reactions to things like stressful changes at work, illness of a loved one, maybe relationship struggles, or financial uncertainty. Now, the thing is that they're usually resolved through things like use of personal coping strategies or taking some downtime, or it may even be by connecting with family and friends or by speaking with a counselor. So, what about mental health disorders? Well, they differ because they're actually a range of medical disorders that affect our mental health. So, mental illness impacts the way that we think about and interact with ourselves and others in the world around us. They're severe enough to affect our day-to-day functioning. We often have a disconnect. We lose connection with our behavior. Almost always, mental health disorders are diagnosed by a family physician, and it's really all about the gray. So, it's not black and white when dealing with mental illness or mental disorders. Mental illness or mental disorders changes the brain function, so it's absolutely critical to get treatment. If left untreated, it will get worse. It requires medical intervention, which often includes medication as well as medical, paramedical, or psychological therapies to help the individual recover. Now, a question I always get is, why do some individuals go off for mental health issues and others do not? Well, to answer your question, let's think about this or compare it to things like, why does someone suffer from hearing loss or someone suffer from asthma and others do not? Some things happen in life that make us more vulnerable. Early instances can make us more vulnerable later on in life. And just like physical health, we have a continuum. We may be at different points on this continuum at different times in our life. Okay, and they range from having the normal ups and downs of life through temporary mental health problems to active mental disorders. So as we just mentioned, certain things can make us more vulnerable. But generally speaking, when we talk about the cause of mental illness or mental disorders, it gets very complicated. It's a combination of biology, psychological, and social factors. So the biological components include things like genetics and brain structures that may predispose you to mental illness. Psychological components include behaviors, emotions, and cognition, really how we see ourselves or how we feel about things. And the social components include relationships and social environments. And all of these components are interconnected and all contribute to mental health. There is no one simple cause, and people don't just get over it. So let's discuss the three most common mental disorders, starting with major depressive disorder. Before we get into the types of mental disorders, though, I do want to mention I'm not a doctor. You're not a doctor, so neither one of us can legally diagnose ourselves or another person. If you think you might be experiencing one of these disorders, talk to your health professional, such as your doctor or psychiatrist. Okay? Now, major depressive disorder falls under mood disorders, and they're exactly what they sound like, illnesses that affect mood. Individuals experience moods outside of the normal range and that are longer in duration and with more severe symptoms. Now you can see here it's when you have 5 or more of these symptoms that last 2 weeks or longer. The main symptom, though, is typically sad, empty, despairing, or angry mood that is always present and lasts most of the day. It also impairs individuals' performance at work or at school and in relationships. And you really have a loss of interest in work, in hobbies, and with the people that you like to normally hang out with. Now, major depression can be recurrent, so people can recover or may recover, but they may develop another episode later on. And it affects about 13% of Canadian adults at some time in their lives. And in the workplace, depression is one of the leading causes of absenteeism and lower productivity. Now, the second most common mental disorder is anxiety disorders. Now, why do we have anxiety? What function does anxiety serve biologically? Well, it's there for protection, to offer that concern and care. It's there to motivate us for that growth and learning. Anxiety is a normal feeling that everybody experiences at some time. And it's a natural response that's useful in helping us avoid dangerous situations and motivating us to solve everyday problems. When it becomes a concern is when that uneasiness or panic is severe and long-lasting and interferes with our day-to-day living. It also is important to note that these feelings are happening or occurring when the individual is not in danger. Now, anxiety does affect 1 in 10 Canadians, and it often leads to depression. More than 70% of individuals with anxiety-related disorders have one or more other diagnosable mental health disorder. Now, anxiety can manifest itself in many ways. So if we look at the psychological ways that it can manifest, we're really talking about things like people experiencing fear and trepidation and that imminent danger or sense of impending doom. Individuals may have excessive worry, may have a fear of dying or going mad. Their attention span decreases and they may have a hard time concentrating. One's environment becomes unfamiliar, it doesn't seem real anymore. They feel detached, and they may have a speeding up or slowing down of thoughts. Individuals with anxiety disorders are often easily distracted and irritable. They often suffer from insomnia as well as vivid dreams. Now, from the physical standpoint, anxiety disorders affect individuals' cardiovascular, which is things experiencing like heart palpitations, chest pain, rapid heart rate. From a respiratory standpoint, they may experience hyperventilation or shortness of breath. From a neurological point, it may be that they have dizziness or headaches, vertigo, tingling or numbness of the skin. They may experience gastrointestinal responses like choking or dry mouth, nausea, vomiting, diarrhea. And then musculoskeletal, where you have muscle ache and tension and or restlessness. Okay, so it can be pretty severe. Now let's touch on the third most common mental disorder, which is adjustment disorders. Now, you may have heard of in the past things referred to as situational depression. That is now considered an adjustment disorder. So they've changed the terminology. And what adjustment disorders are is really an abnormal or excessive reaction to an identifiable life stressor. And it's where those symptoms do not go away, even after the stressor has been eliminated. Okay, the reaction is more severe than it would be normally expected, and it can really impact or impair your functioning in work, in school, and with relationships. Now, the response may be linked to a single event, something like a fire or maybe even starting a new job, or it might be related to multiple events, something like somebody who's suffering from marital problems or having severe business difficulties, or maybe it's from having stressors that are recurrent events, things like a child witnessing parents constantly fighting, or someone who has financial difficulties. Or it could be a continuous stressor where you're living in a crime-ridden neighborhood. Now, adjustment disorders often occur with one or more of the following: either a depressed mood, anxiety, disturbance of conduct, or maladaptive reactions, which are like problems related to work or school or social isolation. Now, adjustment disorders are often associated with a high risk of suicide, as well as substance abuse. So it's very important that if you're going through or noticing that your reaction to a life stressor is more severe than it maybe would be, it's important to ensure you get treatment, because otherwise it may progress and become a more severe mental disorder, something like major depressive disorder. So knowing that you need or want to ensure that you get treatment, let's just touch on that now. So we want to stress that the approaches to mental ill health should be fundamentally the same as approaches to physical ill health. People who have mental health problems or disorders need respect and assistance. Now, treatment is different for everyone. What works for one person may not work for another. In general, treatment falls into the same categories as the causes. Now, we would not let a physical injury go, but sometimes we let a mental injury go, and we need to stop this. We do need to look at mental health issues as an injury. So when we're looking at biological treatments, this includes things like medication and maybe even in some severe cases, surgery. Now, it's important to note that it can take some time to get the right dose of medication, and you need to be willing to work with your health professional to get it right and have the right balance. We also need to make sure that we're aware that medication is not a crutch. But even if it was, so what? You're injured. If someone was diabetic, is there shame in them taking insulin? We need to look at it the same way. Now, if we look at psychological therapy or treatment, we're talking about therapy, things like psychotherapy or cognitive behavioral therapy, or CBT as it's most commonly known. You really cannot beat mental health disorders without this. It's not easy though. Oftentimes, individuals need to relive situations that were very difficult. But CBT can be a very effective approach because it really works to change the ways that you think, which is that cognitive piece, to impact what you do, your behaviors. So it really understands that thoughts, feelings, and behaviors are interrelated, and making changes to the way we think will change our feelings and behaviors. Okay. And then social treatments really address the social side of mental health. Things such as peer support or support groups can be very effective. Now, it's important to note that these need to be friends or coworkers, not family. These are so helpful because it makes individuals realize they're not alone, and it really helps them to understand. It also makes them feel less isolated. This can be the most important piece in treatment, especially when we talk about mental illness and the path to suicide. We can actually save lives with peer support or support groups. Now, recovery is about much more than achieving the absence of symptoms, and it can be a long process that's often described as a journey. Now, it's important to note that there might be setbacks along the way, and that's okay. It's important to note and recognize that recovery might take time. So now that we've touched on what is mental health and temporary mental health problems and mental health disorders, the causes and treatment, let's talk a little bit about some mental health misconceptions. What are they? Well, that mental illness is a cry for attention, that it's a sign of weakness, that people that experience mental illness are violent and dangerous, or that mental illness is an excuse for bad behavior. that it's the parent's fault or the result of poor parenting, the fact that children don't get mental illness, and that people don't recover from mental illness. These kind of misconceptions can cause us to take an us versus them perspective. And if there's one thing I want you to walk away with today, it's this: removing the us versus them. We need to recognize the common ground. When we allow for misconceptions, we're allowing for distance and stigma. And we don't want that. So, mental health awareness. These are some statistics here that really just show the impact that mental health has on Canadians in the workplace. And I want you to consider this. 1 in 5 Canadians will experience a mental health condition this year. It's pretty significant, and it's probably underrepresented. How many of those receive the right treatment? Only 1 in 8 individuals receive the right treatment. Now, we spoke earlier about depression being the most common mental illness in the workplace. Of those that are diagnosed with depression, 78% of those individuals will keep it to themselves for fear of losing their job. We need to change this. In terms of being a major disease state, mental illness dwarfs the other 2 major ones, being diabetes and heart disease. 6.7 million people have mental illness in Canada. Only 2.2 million have diabetes and 1.4 have heart disease. So again, that just shows the impact of mental health, mental illness. Now, each and every week, 500,000 Canadians miss work due to a mental health issue. So what can we do? We know employees want mental health programs. 60% actually want them. Now, only 21% of employers offer them. So we need to start doing a better job. So let's talk a bit more about mental illness and work. Mental illness does not mean that you cannot work. It just means that you may face different barriers. Things like stigma. Oftentimes, mental illness is an invisible illness. So people might be embarrassed or have privacy concerns. Or maybe they have fear. Or maybe it's a cultural or location barrier. It might also be that they have a barrier in accessing resources. So those are the things that we need to keep in mind. Now, in order for someone to be productive at work, we may need to consider some adjustments or accommodations. And we need to ask ourselves in 3 areas of whether or not this would be helpful. The first one being functional. So these are things about flexible scheduling, modifying job duties, or allowing for time off for medical appointments. On the cognitive side, things like changes in training, or maybe the use of technology, or modifying a workspace or changing your location. And from the relational aspect, do we need to increase or decrease the amount of supervision? Does an individual need support in prioritizing their work? Do we need to change the way instruction or feedback is given? These are all things to keep in mind when we're talking about mental illness at work. Now, there's a number of support areas that you can tap into. Your leader, your HR department, health and wellness programs, your EAP or employee assistance program, peer support programs, take assessments, talk to therapists, utilize online resources, go through training, and participate maybe in mental health first aid as well. Now, the workplace has a big impact on stress, and stress is a precursor to mental health issues. We want to be able to recognize when someone may be struggling. So these are some of the things that we want to be mindful of. These are what might indicate that an employee or colleague may have a mental health concern. We have to remember our environment has a big impact on our mental health, and the workplace is no exception. We spend 1/3 of our day at work, so it's going to have a huge impact. And managing work-life balance is extremely important. In the workplace, mental health problems emerge in many different ways. An employee could doubt their abilities, have less confidence, have trouble concentrating or learning or making decisions. Maybe they're withdrawing from social relationships or acting strangely or appearing less productive. These are some of the red flags to look for, in addition to the ones that we've stated here on the screen. If you are concerned about yourself, talk to someone. If you're concerned about a coworker, try talking to them. It's important to emphasize that people behaving in the ways that we see here on the screen, like frequent breaks or lateness or lack of participation in team meetings or maybe missed deadline or an error, things like that, people might just be behaving in these ways because they're simply having a bad day or a bad week, or maybe they're working through a difficult time in their lives that's temporary, something like a divorce or maybe grieving the loss of a loved one. But a pattern that continues for a longer period of time, so when you have 5 or more of these symptoms that last more than 2 weeks, it may indicate an underlying mental health problem. And we want to make sure that we can recognize these signs and symptoms, because if we can recognize these, we can ensure proper treatment and early treatment is obtained. And most people can quickly return to the normal performance at work and in their life and potentially avoid any unhappiness and suffering. So you've probably all heard a lot about stigma with Bell Let's Talk and with celebrities like Lady Gaga and Ryan Gosling, who are putting a face to their own mental health struggles and challenges. But what is stigma? Well, it includes stereotypical thinking that may result in negative behaviors and unfair treatment of individuals who are experiencing mental health problems or mental health disorders. Stigma makes people feel ashamed of something they didn't choose and something that isn't their fault. Now, telling someone their illness is all in their head is like telling someone with asthma that it's all in their lungs. And that's just something you would never do. So why do we do it with mental health or mental illness? There are 3 types of stigma surrounding mental disorders. The first one being self-stigma. This is when you question your personal value instead of questioning the stereotypes placed on you. Then there's public or societal stigma. And this is where there's a bias against people living with mental disorders and you reject and discriminate them. And then there's associative stigma. And that's where those close to us encounter shame and discrimination because of their family member or friend who's suffering from a mental disorder. And associative stigma actually affects up to 83% of family members, which is pretty high. So how can you respond to stigma at work? What are some of the things that you can do? Well, we can recognize that mental health issues affect anyone at any time. We need to learn to recognize when an employee is struggling. We need to be aware of our own misperceptions, assumptions, and stereotypical thinking, and not let our own fears prevent us from speaking up or speaking to a team member who's struggling. We want to be able to recognize and respond to behavior that perpetuates stigma and put a stop to it. The same way we don't make racial slurs, we don't want to make mental health slurs either. If there is no stigma, people are going to get treatment earlier, and it's less likely that it's going to impact them at work and that they need time off. Responding to stigma sets the tone for a positive, respectful, and mentally healthy workplace. So what are some other things that we can do? Well, we can put the person first. Don't refer to the person by their illness or disorder. Become informed about mental illness, disorders, and don't be judgmental. Speak up about stigma. Don't let jokes or misinformation go. We need to make sure that we're talking openly, that we don't treat mental illness or disorders as something to be embarrassed about. And we want to make sure that we're using appropriate language. Language is very important when avoiding stigmatizing those with mental illness or disorder. We don't want to say things like crazy or psycho or special or mentally ill or victim. We don't want to use that type of language. We want to use a lot more positive language. And then lastly, education and awareness. So participating in trainings and workshops and seminars, being a mental health champion, speaking up about mental health, doing campaigns around it, all of that can be helpful. Remember, it's not us versus them. Mental health and mental illness affects us all. Keep these things in mind and do your part to end stigma in the workplace. So now that we've touched on mental health, mental illness, mental disorders, and stigma, let's talk a little bit about stress. Now, stress is not what happens to us. It's our response to what happens, and our response is something we can choose. And since our reaction causes positive or negative stress, being mindful of how we react is important. When we perceive a situation as manageable, it is considered positive stress. It motivates, challenges, and inspires us to rise to the occasion. But on the other hand, negative stress occurs when we do not think we can manage a situation or meet the challenge, and this type of stress drains our energy. Now, you can relate stress or managing stress to building muscle. The key is finding the proper balance. Too little weight will not produce the desired results, and too much weight will result in fatigue and possibly injury, again, not producing the desired results. You need to overload the muscle just enough to make it stronger. It's the same with stress. If we have too little stress in our life, we're bored and lethargic. However, too much stress leads to physical and emotional breakdown. Finding the right balance leads to a productive, energetic, creative, and healthy life. So, what causes us stress? Let's talk about that. Because one of the key to effective stress management is maintaining awareness of the potential stressors and readiness to address them before they become problematic. So what are those stressors? Well, there's many examples of workplace stress. They can be things like poor communication, work overload or underload, maybe shift work or night work. If you're isolated or you don't have enough support and you're a remote worker. If you're on contract, if you have role conflict or ambiguity or changing roles, if you have a lack of training or there's just so much redundancy in your role, if you have an uncomfortable workspace, if your organization introduces a new technology, which seems to happen all the time these days, if you have a culture of presenteeism, if there's work-life imbalance, and if your home-based stresses that reinforce or feed off of become work-based stresses. Okay? So, what happens to our bodies when we undergo stress? Well, the general adaptation syndrome is comprised of 3 phases. The first one being the alarm reaction phase. And in this phase, the fight or flight response is activated. And when you're exposed to a stressor, the adrenals are stimulated to produce more adrenaline and cortisol to provide that superhuman strength so that you can fight or run away from harm. However, in the vast majority of cases, today's stressors don't require us to fight or flee. Recall back to the last slide. Those were mainly things that were primarily emotional or mental rather than physical. But regardless of the stressor, the adrenals produce the same response. It's extremely important to exercise during this phase to burn off that excess adrenaline. Otherwise, it causes inflammation in your cells, which can lead to all different disease states. And this is a condition that can and does build up over the years. So in this phase, we're stressed and wired. And as we mentioned, we have that elevated adrenaline. We have elevated cortisol. Now, we also have a depletion of our vitamins. The body uses up the little amount of vitamin C that is stored immediately during times of stress. And the body uses more B vitamins. So it's important to ensure that your diet supplies more or includes supplements during stressful times. And then also your digestion is paralyzed. Your digestive system shuts down, and that's to allow your physiological processes to concentrate on the situation at hand. So during stressful times, it's important to eat small, easy to digest meals. Now, during this phase, you're going to find that maybe you have more energy, you need less sleep, and you're quite alert. You may be highly functional in this stage, but you can't stay in this stage very long. And then we move into phase 2, or the second stage, which is the resistant stage. This is when you're stressed and tired. Okay? Your body has reduced adrenaline, but it still has the elevated cortisol. And with elevated cortisol, your body assumes a famine has ended. Cortisol is an anti-famine hormone, and it craves carbohydrates to build the body back up. This causes fat to be stored in the midsection, contributing to visceral fat, metabolic syndrome, and symptoms associated with them. Now, you may also experience physical and emotional signs of distress. So you might find that during this phase you experience sleep interruptions, like waking up at 3 a.m. with your mind racing. You might experience that your energy is really low and that maybe a dependency starts to form, whether that's on sugar, caffeine, alcohol, or drugs. This resistance phase can often be the most dangerous because it's during this period that our bodies prepare themselves physiological to adapt to stressors. The more time that we spend in this phase, the higher at risk we are to develop stress-related illnesses, ultimately leading to exhaustion, which is the third phase. We also might consider it burnout. And in this phase, we have low adrenaline, low cortisol, low anti-aging hormones, imbalanced sex hormones, and this is when disease sets in. Individuals in this phase lose motivation, energy, and may even request a leave of absence from work. Symptoms may appear or the illness may occur or be diagnosed within 12 months following a stressful period, so it's not always right away. And when an individual goes off on stress leave, it may take 6 months to 3 years to fully recover. Now, it doesn't mean they're off work for that time, but that may be the process. Now, notice, if you recall, in phase 1, exercise is extremely important to burn off that excess adrenaline. But in stage 3, if you hit this stage, exercise is not recommended. Just rest. So now that we know what happens in our bodies during stressful times, let's take a look at the signs of distress. Now, we have to remember that stress is not what happens to us, but it's our response to what happens, and it's something we can choose. Most personal, social, and occupational events by themselves are not stressful. How we react to or perceive them determines whether they will cause us distress. And how we view our own stress is an important variable. So here are some of the signs of distress that we need to make note of. From a physical standpoint, if we have muscle tension or headaches, upset stomach, difficulty sleeping, or we feel fatigued, shallow breathing, cold hands and feet, trembling or shakiness, frequent illness in the way of colds or flu infection, and whether we're maybe grinding or clenching our teeth. From an emotional standpoint, are we worrying or having anxiety more? Are we feeling angry or irritable? Do we feel hopeless or trapped or out of control? Do you feel guilty or self-conscious? Also, we have to keep in mind about feeling incompetent. Now, from the spiritual side of things, do we question values? Do we have a loss of purpose and meaning? Are we isolating ourselves from our family and friends? Do we feel like we're experiencing loneliness or excessive busyness? From the intellectual side of things, do we have impaired judgment or the inability to concentrate? Are we easily distracted? Are we forgetful? Do we have difficulty making decisions, and do we procrastinate? We need to make sure we pay attention to these signs of distress. This can be a challenge when we are under a lot of pressure. But if we're feeling chronically fatigued or irritable or having any of these other signs, we might be experiencing a problem with our mental health, particularly if the situation lasts longer than 2 weeks. So now that we've talked about that, how can we better manage our stress? Well, don't overextend yourself. Slow down and learn how to say no. This is easier said than done, but if you find this difficult, remind yourself that saying no allows you to say yes to the things that you truly want to do. Cutting back on whatever commitments and activities you can will give you time to rest, reflect, and heal. Now, sometimes we can't eliminate the cause of stress, but you do have the power to change your interpretation of the situation and the way you think about it. Look at how you currently handle stress. Is there something you can do differently? Be accountable. Talk to someone you trust about your feelings and your situation. Simply sharing your feelings with another person can relieve some of the burden. Don't be afraid to ask for help. Also, make time for yourself daily. It can be as simple as taking a 10-minute walk, taking a break from technology, spending time meditating or doing gentle stretches, or even reading your favorite book. And also try to take vacations. even if it's a staycation. When you're doing something you absolutely enjoy, your mind usually leaves the negative stressors behind. When we do our most preferred activities, we are more mindful and focused on the present moment. This focus promotes relaxation. Remember to laugh and make others laugh. Remember that saying that laughter is the best medicine? Well, there's some truth to that. Adopt a healthy lifestyle. When you eat right, engage in regular physical activity, and get plenty of rest, you have the energy and resilience to deal with life's hassles and demands. And also, don't forget about volunteering. Giving back does wonders. And then lastly, to better manage your stress, practice stress reduction strategies. Let's give you a few examples of what some are that you can try. There's a number of them, and it's important to try different ones to find what works for you. So the power nap. This combines several elements of many relaxation exercises, including deep breathing, mindfulness, and yoga to relax, rejuvenate the mind and body. When we talk about relaxation or progressive relaxation, we're talking about the mind-body process of effectively moving from the stress response to the relaxation response. Relaxation produces many health benefits, such as slowing your heart rate, reducing your blood pressure, slowing your breathing, reducing your need for oxygen, increasing blood flow to your major muscle groups, and lessening your muscle tension. When we specifically talk about progressive muscle relaxation, or PMR, which is one of the most common used forms of relaxation therapy in Western society, it involves consciously tensing and relaxing muscle groups progressively throughout the body. This reduces overall muscle tension. Relaxation breathing. We're going to touch a little bit on this later, so I won't go into this now, but shows great promise as a coping technique for common anxiety and stress. Guided imagery. This is a technique used to connect with the subconscious mind in a way that will activate the relaxation response. It is used to calm the mind and body by suppressing the sympathetic nervous system and creating homeostasis. By imagining a relaxing scene in your mind, your body will respond as if you were actually in this relaxing spot. The imagination has a powerful impact on the mind and body. Meditation. This is a process of systematically allowing the mind to focus gently on a single item. In the process, the mind tends to think more clearly as the mental chatter quiets. The result is a mental state of alert relaxation. Now, meditation means different things to different people, and there are many different types of meditation, so adapt your practice to work for you. It's a useful intervention in reducing stress and in dealing with a wide variety of stress-related illnesses. It's simple and powerful, and it enhances our health and well-being. Now, yoga. Yoga signifies the union of the mind, body, and spirit into one whole. There are many styles and variations. However, Hatha yoga focuses on simple flowing poses along with breathing and meditation, making it especially effective for relaxation. Complementary and alternative medicine. These are things like traditional Chinese medicine, naturopathic medicine, reflexology, acupuncture, massage, and they can be highly effective for preventing stress-related conditions and for promoting balance and well-being. But ensure you take responsibility to investigate what's acceptable, safe, and effective for you. Laughter and humor. We touched on this earlier. Laughter can help prevent stress and has positive health benefits too. Laughter is associated with a release of tension and an increase in endorphins, which are our mood lifters. And humor can empower people by giving a different perspective. If you can learn to see humor in a stressful situation, the response to the perceived threat often changes. Now, music has long been used to affect our mood and influence how we feel. It has been used to calm the mind and body and spirit. Music is definitely used to help cope with difficult situations. Now, what type is best for stress management? Well, you need to decide what works for you, but classical and new age have been found to be most effective. Journaling or writing. This can be extremely effective. It's a proven way to release your emotions. Once you move your thoughts to paper, you may want to throw them out, or you may want to reflect on them. The stress-relieving value often comes from the simple act of getting your thoughts out of your head and down on paper where you can see them. Exercise. This is one of the most powerful stress buffers for a variety of reasons. Numerous studies have shown that exercise reduces anxiety, muscle tension, and blood pressure, which are 3 measures of stress. Exercise also makes you feel better by improving your mood. It releases those endorphins similar to laughing, and it increases your energy. Now, nutrition, this is extremely important. Stress can initiate altered eating behaviors from one end of the spectrum to the other. And the results are fatigue, low energy, and an overall decline in the ability to deal with stress. Healthy eating is an important component for optimal health and well-being. A well-nourished body is best prepared for dealing with the stressors of life. And then sleep. Getting a good night's sleep isn't as easy as it used to be in today's busy society, but getting adequate sleep is vital to maintaining good health and reducing stress. Insufficient sleep is a prominent stressor and is responsible for a host of problems. Now, there's no right amount of sleep for everyone, but most adults need 7 to 8 hours of sleep per night. Now that we've talked about some of these stress reduction strategies, what are some of the things that we can do to help yourself cope with stress and stay resilient? Well, we touched on some of these earlier with regards to physical activity, nutrition, sleep, relaxation exercise, but also make sure you visit your physician regularly. On the emotional side, make sure you express your emotions. Vent to someone who cares. Talk to a professional. On the spiritual side, we need to remember about mindfulness, and we're going to touch on this in just a moment. We need to be present. Practicing meditation can be very helpful. Also, prayer or talking to spiritual advisors or religious leaders. And on the intellectual side, monitor your self-talk and adjust. Be aware of your tone of voice, your message, and your body language. Be your own mental coach. Participate in cognitive behavioral therapy. That can be very effective. Now, try not to let things build up. Take a one thing at a time or a one day at a time approach. Don't sweat the small stuff. And a couple other pieces is remember that nature is a buffer as well, and it supports both emotional and physical health. It actually is shown to decrease depression, anxiety, and ADD. Now, where can you turn to? Or what are the resources for support that are available? Well, in your workplace, your leader, your human resource department, training programs, your employee assistance program, any health and wellness programs you have, and think about peer support. Personally, talk to your general practitioner or other health practitioners. Talk to a therapist. Talk to family members or friends. And in the community, there are many resources. These are just a few, but there are many available that you can tap into for support and great tools. Additionally, one thing that's very beneficial to practicing is self-compassion. And self-compassion really means treating yourself as you would treat a good friend. And we often forget to do that with ourselves. It's made up of 3 parts. The first being self-kindness. Be warm to yourself and understanding. Realize that failure is inevitable and relate to yourself kindly when it happens. Common humanity is the second part. Understand that you're human and everyone goes through hard times. Everyone is imperfect and vulnerable, and it's about seeing that you're not alone. And the third piece is mindfulness, being in the moment, seeing and looking at things openly and without judgment. And the benefits to self-compassion are that it protects against anxiety and depression. You're going to have higher productivity. It helps keep you calm in the midst of failure, and it engages your biological nurturance, which leads to feelings of well-being. So keep this in mind. Now that we've talked about helping yourself, how can you help others? Well, become aware, educate yourself, talk about it, talk about mental health, actively listen. Don't just try to solve their problems, don't silver line the situation, and don't judge or jump to conclusions. If there are accommodations or adjustments that you can make, do so. And put it on the agenda. Any time at work that you can put it on the agenda, do so. Whether that's team meetings, whether that's one-on-ones, can be extremely helpful in helping start the conversation and will help reduce that stigma. So now we want to take a moment to touch on mindfulness. Mindfulness is a basic human ability to be fully present, aware of where we are and what we're doing, and not overly reactive or overwhelmed by what's going on around us. Mental clutter can be just as stressful, if not more stressful, than physical clutter. Sensory overload is like a blackboard filled to capacity with notes, scribbles, and information that's difficult to organize and understand. And a cluttered mind becomes a stress mind. Practicing mindfulness is like an eraser that cleans the mind's blackboard. Mindfulness unclutters the mind and brings about mental tranquility. Remember, stress only occurs when we allow our minds to think of things other than what is happening in our current experience. We focus our thoughts on possible future events, things from the past, or about things that might be happening elsewhere. That's when we experience stress. Mindfulness turns off the stress response and, as a result, facilitates relaxation, reduces stress hormones, and boosts the immune system. When we're in the present moment, there's usually no cause or concern for stress. So, what are some simple triggers that you can use? Because mindfulness won't happen by accident. You need to think of a simple trigger that you can use throughout the day to remind you to be in the moment. So we're going to share 3 with you, and hopefully you can incorporate one of these into your daily routine. So as soon as you wake up in the morning, rather than jumping out of bed, pause long enough for 3 whole breaths to pass naturally. It will only take a few seconds, but it will set the tone for the day ahead. Another one is when you brush your teeth. Make it an exercise in mindfulness. Rather than simply thinking about stuff, direct your attention to the physical sensations, like the smell and the taste and the feel of the bristles. And in time, it actually can feel like a mini meditation. This third one, whether you drink tea, coffee, or juice in the morning, make it a ritual. Sit down with it, even if it's only for the first few sips. Be aware of the smell, of the taste, of the temperature, and savor the moment, and realize when your mind has wandered. Sure, to begin with, mindfulness may only last 30 seconds or so, but with practice, it may become more often and it will become longer. Remembering to practice no matter the length is the starting point. Now, your respiratory rate at rest can be a good indication of your state of relaxation. So we want to do a little exercise right now to record the number of breaths that you take in 1 minute. We want you to count how many natural, effortless breaths you take. Try to breathe as naturally as possible and count each inhalation and exhalation as one. And I want you to take note of what that is. So we're going to start this doing now. And go. And stop. Make note of the number of breaths that you took. The average respiration rate is 12 to 16 breaths per minute. A faster breathing rate might be an indicator of higher than desired stress levels. So this is a simple exercise that you can do when you think maybe you're under a bit of stress, to take note of whether you need to take some deep breaths, whether you need to practice a relaxation exercise. There are many different breathing exercises that you can try, and we would suggest trying them for several days and in various situations to determine the technique that works best for you. Really, conscious breathing is a component of nearly every relaxation technique. Whether it's used alone or in combination, the benefits are immediately obvious. Breathing is one of the most normal and natural processes and may turn out to be one of the most effective strategies for you in reducing stress and enhancing your sense of peace and well-being. Now, we talked about all of those stress reduction strategies and relaxation strategies. What are the benefits? Well, after practicing relaxation, you're going to experience fewer symptoms of illness. So less headaches, less nausea, diarrhea, pain. You're going to have fewer emotional responses, so less anger outbursts or crying or anxiety or apprehension and frustration. You're going to have more energy. You're going to be better able to handle the daily problems, and you're going to be more efficient in your daily activities. So again, there's so many benefits. Before we end, I would like to just touch on happiness. If you implement these 5 things into your daily life, you will instill more happiness. If you take 3 20-minute brisk walks in nature each week, if you do a 20-minute reply where you journal about the positives from your day, this will invoke the same feelings as when you experienced it in the first place. Perform a random act of kindness each day. Start practicing meditation or mindfulness. Now, there's some good apps out there like Headspace and Calm.com, but lots of them. Check out what works for you. And then practicing the 5 gratitudes. What this means is writing down each and every day 5 things that you're grateful for. It really will hone in on your perspective, and it will just make sure that we're looking at the positive light, which can do wonders for our mental health. Now, I recognize asking you to do all 5 of these things each day or every week might be difficult. We're extremely busy. So I'm going to suggest if you can only do one thing, the one that will have the most benefits is performing a random act of kindness. So in summary, mental illness and mental disorders are very complicated and they're different for everyone. And in fact, they do affect us all. Work plays a huge role in our mental health. We need to remember to talk openly about mental health so that we can work to decrease stigma. And then lastly, make sure that you take time for yourself. It can make all of the difference. I want to thank you for participating in today's webinar. If you have any questions, please email wellness@peoplecorporation.com. And I would encourage you to take a moment and complete a short, confidential evaluation, and the link can be found on the HRIS homepage.